I'm here today with Rich Boyajian, who's a colleague and a friend, talking about issues related to survivorship. Rich, thanks for being with us.
Thank you for asking me, Dr. Miller.
So let me ask you, I'll ask you a personal question.
Sure.
Maybe you could share a little bit because you've had your own experience, and how many years has it been?
Well, I'm a cancer survivor myself and had a bone marrow transplant almost 13 years ago for leukemia. And not only am I talking about it from a provider standpoint, but when I was diagnosed, that was obviously the most fearful time and worried about everything. But then actually it was surprising to me that when I was discharged from the hospital after my bone marrow transplant, I couldn't believe how nervous and afraid I was because I just didn't know what was going to happen next. I had no idea what was in store for me, for what testing, what follow-up. Even though they may have explained it to me, I didn't really remember most of it because it was so overwhelming at that time.
All right, so along those lines, you are one of the strongest advocates I know for an end-of-treatment summary and a care plan. What is that?
Really what it is, I think of it as putting down on paper what the providers already know. What it really is summarizing what you had for treatment. So talking about your diagnosis. So if you were a leukemic patient, it would give you information about your diagnosis, the date of your diagnosis, what type of leukemia you had, and then also what type of treatment you had, including chemotherapy, radiation, or surgery, and if any of this was done on a clinical trial. And the reason that's important is to keep a running list going forward because long term we do worry about late effects. We do worry about long-term effects of chemotherapy and radiation, as well as surgery.
Potentially, what would they do with that? They take it home with them, and how else can they use it?
Well, probably the most important part is for information for both the patient to have in their records, but also to be part of the medical record in the oncology setting. But even more importantly, it's to inform the primary care physicians about what their patient has just gone through, so that it gives them information to go from, because oftentimes what we find is that cancer survivors lose track of their primary care physician, and they tend to spend all of their time in the oncology setting, even getting their primary care needs met in the oncology setting, at least early on. And the second part of that, which I actually think is even more important, is a follow-up plan, which is really about how am I going to be followed now that I'm done with treatment? What are these next few years going to look like? Because one of the biggest issues is we don't know, as a survivor, you're not sure, how often do you need tests. What I often say to patients is, if you ask any provider, when you walk into the room, they know exactly how they want to follow you. You're done with your treatment. They know how often they want you to come in for visits. The provider also knows what labs they want from you and what scans, if they want any, and how often all of these are going to be done. They actually have this figured out in their mind, how often the first year, the second year, the third year, and so on, where they have it mapped out. So if everything goes smoothly, they have kind of a roadmap for themselves of how they're going to follow patients that are similar to you. The problem is they know this in their head, but they're not putting it down on paper for patients. And as we've talked many times, and we're really moving forward, is we think that it would be very valuable to provide this written document that provides people with a summary of their treatment, but also what is their follow-up care going to be? Because I think that may help relieve some of the fear of the unknown that they have.
So as the last question, any one or two or three sort of recommendations you'd give for patients finishing treatment?
I would go to your primary provider, and I would ask them what was I treated with, and what was my diagnosis. Could I have that in a written summary so that I can keep a record of it and send one to my primary care physician? I would ask them a simple question. What I was treated with, does that have any risks for me that we should be concerned about long term? And if so, I would ask my provider, what are we going to do to prevent or to detect anything early? What's our plan going forward? Again, for survivors, if you remember your on-treatment care, it was so orchestrated in regards to this is how we're going to treat it. We know what treatment we're going to give. It's the primary treatment because of all the studies, and we know that we're going to give it to you every 2 weeks for the next 6 months. Well, they have a plan then, so you should be entitled to a plan once you finish treatment as well. And again, what it is simple questions about what was I treated with, what am I at risk for, and how are we going to develop a plan to go forward to make sure my life is the best it can be for the rest of my life.
Thank you. Wonderful summary of the whole topic of survivorship care plans and treatment summaries, and how that may be very important for cancer survivors moving forward and living well beyond cancer.